As a licensed physical therapist and fitness expert, our next guest was the picture of health. But despite how he looked on the outside, the turmoil he was facing on the inside ultimately left him fighting for his life.
My life was what most people would strive for, having a business, home, raising a family. But then there was a sudden turn. In a 12-month period, everything that could have gone wrong went wrong. From being personally sued because of one of my business ventures, and then having my business sued. My wife had an extramarital affair. She was also pregnant from this affair. And on an ordinary Friday evening, I felt some indigestion. I did nothing of it. That morning, I remember waking up, and it was like this level of impending doom. The symptoms had elevated. I was having some shortness of breath, pain underneath my breastbone. I went to a local drugstore. I was drinking the antacid in the aisle. There was an urgent care facility just across the street. And so I went there, they did an EKG, and immediately they told me, "You're having a heart attack." I was petrified. My symptoms had escalated to the point where I thought I was near death. I kept on thinking of my two boys and not knowing whether or not they would have a father to bring them up. Within a minute, the ambulance was there and they brought me to a local hospital where they performed angioplasty with a stent. I thought at the time that I epitomized what wellness was. I ate very well, I exercised often. After speaking with 4 cardiologists, they said, "This is remarkable. My arteries were clean. My blood profiles were healthy," but after giving them my personal history, they attributed this aberration to stress.
And joining us now is Ivan Hernandez. Ivan, sorry for all that you have been through, and yet you've persevered. How's your health today?
My health, I'm the healthiest that I've ever been in my life. Thank God.
And it was one coronary artery?
It was a single vessel disease. Single vessel. But prior to that, my blood work was normal, my EKG was normal, no strong family history on either side, mom and dad. So it was quite of a remarkable story, and it makes you realize that true optimal wellness goes well beyond diet and exercise. I'm not trivializing diet and exercise, that's critical. But if you're not managing stress effectively on a daily basis, you're setting yourself up for some type of disease.
And I want to bring into the conversation via Skype from New York cardiologist, also CBS News medical contributor, Dr. Tara Narula, because this is very unique in the sense that Ivan, they couldn't find anything else going on with him. Can stress, can heartbreak really cause a heart attack?
So stress is a terrible thing. And as Ivan mentioned, we more and more are screening for that as part of our discussion with our patients as a risk factor for cardiovascular disease. And stress can really do 2 things. It can precipitate a traditional type of heart attack where the plaque in the artery ruptures, or it can cause something called a stress-induced cardiomyopathy, as you mentioned, or broken heart syndrome, when you have an acute emotional stressor and that causes a sudden weakening of the heart muscle, and that can lead to heart failure and other problems. So there are essentially 2 different things that can cause, but in essence, it raises your blood pressure, it raises your heart rate, it can cause the blood vessels to constrict, it can increase clotting in those arteries, and it can take a plaque that may have been stable, as in Ivan's case, and make it unstable. And when that plaque becomes unstable, that's when you have a clot form and a heart attack.
And we've seen some recent examples of this in the news, with Debbie Reynolds dying one day after Carrie Fisher, and we hear about these stories where couples who've been married for so many years pass within hours of each other. So I think you can't underestimate the aspect of stress and how it takes a toll.